Welcome to Nursing School Explained and this video on intraosseous access or intraosseous lines. And again, if we dissect the name, intra meaning inside, osseous, the bone, lines. So as you already know, this is a very unusual access site for medication administration. And so it's only used in emergency situations. And of course, it requires special training. So this is usually cardiac arrest. We can't get an IV line. It used to be reserved for the pediatric population because a lot of times it's very difficult for them, for us to get access in the pediatric population. But it's become more and more common as we train more EMS providers to be used in the pre-hospital setting. And it requires a special drill and a special needle, and therefore may require pain medication. And because we're going through the bone, it requires a drill to drill the access through the bone. And so then when we have the access through the bone, it actually then sits, the tip of that catheter sits in the bone marrow where we have access to blood vessels, because remember, every bone is hollow and has blood vessels in there, and therefore we can access or we can administer medications into the central circulation, so it serves just like a central line. It takes less than 1 minute to insert, so it's very easy to use in the emergency setting by trained providers. Of course, once it's accessed or has been established, we need to provide a sterile and occlusive dressing, and it's only meant to be used in the short term and usually in the pre-hospital setting, although I have also seen it used in the emergency department when there is either a cardiac arrest and we can't get a line on the patient, or if there's a pediatric patient, even if it's not an emergency per se, say we're not doing CPR, but this patient is severely dehydrated, they have altered mental status, their blood pressure is not good at all, they meet all this criteria, we just give them an IO, give them a fluid bolus, expand their intravascular volume, and then hopefully we can get either a peripheral or a central line into the patient. Now, the sites that are used for the intraosseous administration can be proximal humerus, proximal tibia, so right at the tibial tuberosity underneath the knee, or at the distal tibia right above the ankle. Now the sternum can also be used, but I put it here in parentheses because think about it, if it's only used for emergency situations and we use the sternum and then we need to do CPR, that IO is probably going to become dislodged and it's not going to be of very good use for us. So the peripheral sites are usually easier to access and also a little bit more helpful from an access perspective. And once we have established the access through the intraosseous line, we can administer any medication that we can also give through a central line. So very, very important to know. And so here is what this looks like. Of course, it is a little bit enlarged here. So these two will usually slide together. So this here is the hub that attaches to the drill, and then we have the stylet. And this stylet and the hub here, they are usually together. So this stylet is inside the catheter attached to the drill, and then once it's drilled into the bone, which would be on the bottom here, we can unscrew on the top here this stylet. It comes off, and then this is where our luer lock attaches, just like a regular IV, and we can hook the regular IV tubing up there, infuse medications, usually epinephrine, atropine, any of those kind of emergency medications. And it's nice because these different side needles, of course, they come in different sizes, and they are color-coded by patient weight. So whenever we have pediatric emergencies, that's where this came from. Everything is color-coded because patients, the medication depend on the patient's weight, in the pediatric population especially. And so it's very easy to then pick a color that's appropriate for the patient according to their weight or the Breslow scale. So thank you so much for watching this video on intraosseous access. Remember, it's only used for emergencies and in the short term. Also check out my other videos on the other types of central lines, and see you soon right here on Nursing School Explained. Thanks for watching.